15 months into COVID, a splash of normalcy is washing over American cities. With millions now vaccinated, masks are coming off.
It's been very stressful.
But not Lana Duran's.
I wish I could feel that sense of freedom.
Lana suffers from lupus, an autoimmune disease. She received a kidney transplant 5 years ago.
I am more at risk of catching COVID-19 and more likely to die from it.
Are you vaccinated?
Complicated question. I did go and get vaccinated.
Here's the problem. It may not have worked. Her antibody tests show no response to the vaccine.
So I don't have any protection.
So let's verify. Are COVID vaccines less effective for immunocompromised people? Our sources: a transplant patient, a rheumatologist, 2 medical studies, a researcher, and an infectious disease expert. An estimated 12 million Americans, close to 4% of the country, are immunocompromised, meaning their immune systems don't work as well. That includes some cancer patients, transplant recipients, those with autoimmune diseases, and more. Most of them were left out of last year's vaccine trials. Now, their vaccine response is being studied, and the early data is alarming. In a study of organ transplant recipients, 46% had no antibody response to Pfizer or Moderna's vaccines, the same results seen in another study of blood cancer patients, when, again, 46% produced no antibodies after their shots, and those who did often showed low levels.
This is very preliminary data.
Dr. Munzer Aga headed that study.
I'm only suggesting for patients with compromised immune system who received the vaccine not to assume that they are immune.
Experts think most of these patients aren't producing antibodies because of immunosuppressant medications they're either taking or have taken throughout their lives.
There are other patients where we'll specifically recommend that they adjust timing of their regular medications around the time of their vaccine.
Dr. Victoria Shan-McGann is a rheumatologist and treats a range of autoimmune diseases. She's one of many doctors testing immunocompromised patients like Lana for antibodies to see if they've responded to the vaccine.
We don't have data that really tells us at what level of antibody number are you protected against the virus. I've had patients have really zero antibody response after being vaccinated. I would have to assume that those patients are still as vulnerable as an unvaccinated individual.
What are you advising those patients about how to live their lives?
I'm recommending they remain pretty vigilant.
The U.S. just hit a massive milestone with more than half of American adults fully vaccinated. But a May Gallup poll found a quarter of the country is still unwilling to get their shots.
Vaccine hesitancy is going to continue to have this virus smolder.
Dr. William Schaffner is an infectious disease expert at Vanderbilt University.
The more of us that are vaccinated, the more difficult it is for the virus to get through us to the immunocompromised person.
And what does it mean for their day-to-day lives?
If people really accept vaccination and we get vaccination rates up about 80+% or higher, then immunocompromised people will feel more comfortable in going out and having a near normal life.
Are you living as though you didn't get the vaccine?
Oh yeah, I am living as if I didn't get the vaccine.
Lana quit her job as a pastry cook last year over COVID safety concerns. Her DC apartment building just lifted its mask requirement for common areas.
I reached out, I was like, hey, listen, I live in this building, I'm immunocompromised, can we change it? And they're like, oh no, I'm sorry, we're following the CDC guidelines.
She just got her first dose of the Pfizer vaccine 2 months after getting Johnson & Johnson's.
I just hope something works.
She hasn't seen her family since COVID started. She lost her grandmother to the virus last year. I can see the emotion in your eyes talking about that.
It hurts, yeah.
So we can verify, COVID vaccines are not as effective for millions of immunocompromised Americans. And unless vaccination numbers climb quicker, their return to normalcy may take many more months.
I feel like a big group of us are left behind.
With your Verify, I'm Gabe Cohen.